This is the first of the day-long seminars we are having on health and the questions of Indian health. And the very first theme that we have for the one-day-long seminar is the impact of the recommendations of 14th Finance Commission. We have been working on this for 7 or 8 months. We are very fortunate that I think almost everyone in the country who works on this is here today. So it's one of those rare things where there are many researchers looking at the same data. Each one perhaps will give us different angles and different ways to look at the same data. At least the papers that I have looked at, each paper has a different story to tell, even though the topic is the same and the data is the same. And this is one of those things that you hear about in the traditions of good economics. So when you talk and good economic research, so when you talk to people at NBER, they say this is the kind of thing they do. When you look at the stuff that's done with labor data, where different people have come up with different matching techniques, different results, they're looking at the same data and coming up with new things. So I think this seminar is a first of its kind in that dimension, certainly, that we don't very often get to see that. As I was saying to Yamini, perhaps by the end of the day we'll be all sorted, because most of the time this is such a difficult topic to figure out. It's so difficult trying to understand what is going on. The data is complex, it's difficult to get. I mean, I've heard stories from all of us that it's in PDF form, you type it in, so the actual data itself is hard. Second, what is going on is also very hard, because the implementation of the FFC recommendations happened sometime during the year, while at the same time there was a change in the way in the sharing of expenditure in the centrally sponsored schemes. So with a change in both, it is difficult to sort out what is the change in the state level expenditure. Also, the data from the states is not something that has come yet, right, Mita? That we have budgeted and we have some revised, but we don't necessarily have the actuals, and they will take some time to come, so it will be difficult to figure out what is going on. Now, to come to the issues, the increase in untied grants to state should in principle allow the states to spend on things that they would like to spend on and they think are their priorities. And when we think about health, there is so much of disparity among states. I mean, even if one takes the simple IMR numbers or MMR numbers, there is so much disparity that obviously different states need to do different things. Also, what is impacting the health outcomes in one state would differ from what impacts health outcomes in another state. It is not necessarily always healthcare expenditure, because we know that among the things that impacts health outcomes, poverty, ignorance are some of the major ones. So what other areas where a state chooses to spend, whether it's healthcare, whether it is the girl child, whether it is building toilets, depends on what the state has and how it can improve its outcomes. So one would think that allowing states to spend more or them having more untied grants should mean that differences start to emerge from what they were doing previously. One, of course, it's, as I said earlier, it's too early to say. Second, there are differences on the ground, what is happening on the states. And third, there are differences in state capacity. So one state might feel that it is able to run hospitals and run them well. where while another might feel that it is not able to do so, and if it is not able to do so, spending more on healthcare might actually not give it much better outcomes. We met one of the chief ministers of a state and tried to persuade her to audit hospitals, public hospitals, or to improve management. And she was very clear that that's not going to work. That's a gone case. I'm going to focus more on other things, which she does. So, priorities will differ. What they choose to do will differ. Now, over the years, if the share in centrally sponsored schemes changes, say it goes down from 60-40 to 10-90, where the bulk is to be spent by the state, or it goes down to 0. I mean, then it won't be a centrally sponsored scheme, I suppose, but let's say it goes down to 10-90, which is the kind of thing we hear about that will happen in the long run. Then perhaps we'll be able to take forward the work that we are starting now, because that's when we'll be getting state preferences will be revealed more than what is happening today. So with that, I would like to invite Ananya to speak. Ananya?